The New Brunswick Heart Center is located at the St. John Regional Hospital in St. John, New Brunswick. Our Heart Center is a single provider of adult tertiary cardiology services for the province and for most of Prince Edward Island. Some specialty services are provided for all of Atlantic Canada. 80% of the patients served come from outside of the Greater St. John area, and depending on the day, anywhere from 5 to 30% of patients or family members identify that they prefer services in French. The Greater St. John area has a population of over 175,000, with only a few thousand francophones. Therefore, we are in a minority setting pertaining to our ability to provide bilingual services. Frequently, in order to maintain services, we do hire personnel with limited or no French language competency. Therefore, our linguistic profiles are never as padded as what it is desired. However, we do manage our demand in a variety of innovative and strategic manners. The Heart Center has an access management or triage department, and all referrals are filtered through this group. The patient's language of preference is identified and entered into a database on booking cards and on various flow sheets as to ensure that this information follows the patient during the episode of care. When known, the language preference of the family member or loved one is also obtained and outlined. It then becomes the responsibility of the department to coordinate care considering the linguistic needs of the patients. For scheduled cases, personnel will control entry into the clinics for Francophone patients to align when a bilingual doctor is covering. If that impacts access in any way, personnel will ensure that a bilingual nurse associate is present to provide interpretation services if needed. The on-call team is coordinated in such a way that if a unilingual doctor is on call, a bilingual nurse or technologist must be part of that call team. However, if the doctor on call is bilingual, the rest of the call team can be unilingual anglophone. Unit assignments are altered on an ongoing basis as to ensure that the communication needs of our Francophone patients and family members are met. Bilingual employees are sometimes floated between MB Heart Center units in order to support our Francophone patients. This is an expectation that's discussed during the interview and rarely causes a problem, as members of the multidisciplinary team will take on additional tasks as to equalize the workload. The MB Heart Center has a contingency of employees with varying French language competencies as verified by provincial testing. Those with advanced or superior competencies would be assigned to tasks such as acquiring an in-depth history or explaining a complex procedure that might follow with many questions. Those with intermediate competencies can tend to the more routine care. All of our employees are trained in the active offer and aware of the unit-specific language contingency plans. So in conclusion, a combination of ongoing recruitment for bilingual employees, further development of existing language competency in current employees, and an effort by all members of the MB Heart Center team that occur more in behind the scenes, ensures that our Francophone patients and family members have access to services in their language of choice in a manner that truly does appear seamless to them from their perspective.